Let's talk Premarin Vaginal Cream, patient and provider perspectives.
I knew menopause was going to happen. I'd heard a lot about hot flashes and mood swings, but no one told me that intercourse could hurt too.
Over half of all menopausal women experience vaginal symptoms, including burning, itching, irritation, and pain. Yet many don't know that these symptoms are due to menopause. If left untreated, they can worsen over time.
When I saw my healthcare provider, I wasn't exactly sure how to bring it up. Painful intercourse isn't a topic that comes up naturally, but I got over it. I knew that if I didn't ask, I'd still be in pain during intercourse.
As a healthcare provider, being able to have an open dialogue with patients is so important. If I'm comfortable having this conversation, then my patients will be comfortable too.
I told my provider about my symptoms and asked if something could be done. That's when she told me there are treatment options.
Premarin Vaginal Cream is clinically proven to relieve moderate to severe painful intercourse caused by menopausal changes. It's a prescription cream that does what no over-the-counter product was designed to do. When used regularly, Premarin Vaginal Cream provides estrogens to help rebuild vaginal tissue and make intercourse more comfortable. I cover this benefit as well as the possible side effects during this conversation with my patients. I also make sure they know how often they should use Premarin Vaginal Cream, how much to apply, and how to apply it. What I've observed with my patients who've used Premarin Vaginal Cream is significant pain relief. I'm happy to help them get there. It starts with having the conversation.
Since I've been using Premarin Vaginal Cream, my pain due to intercourse has really improved. I'm much more comfortable. Now during intercourse, I find myself thinking less about the pain and more about my partner, as it should be. Thinking back about how uncomfortable I felt bringing this up with my healthcare provider, it seems so unnecessary now. The discomfort with intercourse was much worse than the discomfort of that first discussion. You may not have to put up with painful intercourse. I chose to do something about it, and I'm glad I did.
Start the conversation. Ask your healthcare provider about Premarin Vaginal Cream today. Important safety information and indications. Using estrogen alone may increase your chance of getting cancer of the uterus, womb. Report any unusual vaginal bleeding right away while you are using Premarin, conjugated estrogens vaginal cream. Vaginal bleeding after menopause may be a warning sign of cancer of the uterus, womb. Your healthcare provider should check any unusual vaginal bleeding to find out the cause. Do not use estrogens with or without progestins to prevent heart disease, heart attacks, strokes, or dementia, decline in brain function. Using estrogen alone may increase your chances of getting strokes or blood clots. Using estrogens with progestins may increase your chances of getting heart attacks, strokes, breast cancer, or blood clots. Using estrogens with or without progestins may increase your chance of getting dementia based on a study of women 65 years of age or older. Estrogens should be used at the lowest dose possible, only for as long as needed. You and your healthcare provider should talk regularly about whether you still need treatment. Premarin, conjugated estrogens vaginal cream should not be used if you have unusual vaginal bleeding, have or had cancer, had a stroke or heart attack, have or had blood clots or liver problems, have a bleeding disorder, are allergic to any of its ingredients, or think you may be pregnant. Estrogens increase the risk of gallbladder disease. Discontinue estrogen if loss of vision, pancreatitis, or liver problems occur. If you take thyroid medication, consult your healthcare provider, as use of estrogens may change the amount needed. Common side effects include headache, pelvic pain, breast pain, vaginal bleeding, and vaginitis. Indications: Premarin, conjugated estrogens vaginal cream, is used after menopause to treat menopausal changes in and around the vagina and to treat moderate to severe painful intercourse caused by these changes.